It's about a harder question, which is, we can just keep it down a little bit there. Thank you. It's about a harder question, which is, how do we redesign our funding models, our delivery models, our incentives, so wellness does become more equitable? And our CEO for the Americas for Kearney, a global consultancy. And we are here today for a trialogue. That means we're going to talk about health, climate, and humanity, and reimagining systems for a more equitable wellness and regenerative economy. And I'm joined today by some amazing speakers. I'll come to that in a moment, but just in terms of our setup here today, we've just got people coming in and out here, so I'll go ahead. Let me start with a provocation. If we want to preview the next decade of healthcare, don't look at the hospital admissions, look at the weather forecast. Because the climate crisis isn't out there, it is in here. It is in our lungs, it is in our water, it's in our food systems, it's in our mental health, and it's in our supply chains. So today isn't about awareness, it's about a harder question, which is, we can just keep it down a little bit there. Thank you. It's about a harder question, which is, how do we redesign our funding models, our delivery models, our incentives, so wellness does become more equitable and our economies do become more regenerative? At Kearney, we do work within life sciences, within healthcare systems, and we really focus on the how we drive more impact. And so today I'm joined by two very, very inspiring leaders. And very inspired by the prior panel of leaders that we had with us here as well. So I'll start with Dr. Sangita Reddy, so Joint Managing Director of Apollo Hospitals Group. And for many of you who know Sangita, she's a healthcare leader, an entrepreneur, and a humanitarian. She's driving the future of healthcare with technology, with data, with AI across Apollo. One of the largest largest for-profit hospital systems in India, operating in primary care, telehealth, diagnostics, pharmacies, and also expanding well beyond India with impact. We also have Helga Flores Trejo, Special Envoy for Multilateral Affairs of Sustainability at Bayer, working at the intersection of policy, sustainability, food security, climate resistance, and global health partnerships. And Bayer, as many of you will know, is a leader in life sciences, focused on cardiology, oncology, and importantly as well, women's health. So welcome to both of you. Absolutely inspired to be with you today. Okay, so I think really we're here to talk about, not about how we deliver healthcare, but about how we redesign healthcare. And I thought maybe I could start, Helga, with you to really dimensionalize the challenge that we face, and then maybe comment after you've dimensionalized that, how can global corporations work more effectively with governments, and really to address this intersection of health, climate, humanity.
Thanks so much, Carol. I almost feel like I have to apologize to all of you, because after the very inspiring panel we heard before, I think here we're going to have to talk about some hard, perhaps scary facts. In a way, we also, here in Davos, we've been discussing a lot of politics, and that sounds very scary. But the truly scary thing that is constant is where climate change is going and what that means for us, for our health. So again, apologies. I'm going to start with some numbers that I believe are important for us to understand exactly the dimension of the challenge we are facing, and then we'll move to the solutions. But first, the dimension. Let me just tell you that already we are seeing that you can see probably 250,000 additional deaths that you can account based on climate change that you wouldn't have if it wasn't for climate change. But the most important part is that women are 14 times more at risk of being impacted of that. And we'll discuss it in a second. Already in 2025, 8 million people in the world died because of air pollution. And if if I can tell you something about the economic dimension, because this is tragic on a human level and to any of us, human suffering, but what does it mean just economically? And for me, this is, Carol, something staggering, and you're very aware of that. Already in 2024, the world lost 640 labor hours that were lost because people were sick or due to climate change. So this is huge, and if you take the challenge that we face and then look at our health systems, the reality is in the context we are going to be facing these challenges is in a context where 4 billion people in the world do not have the access to the basic health. So that's the challenge. What do we do about it? At Bayer, a couple of years ago, we're starting, and some of you, of course, you will know Bayer because of the aspirin company, right? We are very big in aspirin, that means cardiovascular, but also in food. But being the aspirin company, we are acutely aware of cardiovascular challenges. And we started seeing, of course, with increased heat in the world, that cardiovascular challenges, kidney diseases and other, are affecting humans in a way that it's just increasing very rapidly. So when we said, well, actually, we really need to have a dedicated team within the company that looks at this nexus of climate and health. And I'm very happy that it is a group led by our chief medical officer, absolutely sound research and medical excellence. And he said, okay, we're going to build this almost like a center of excellence within Bayer. And I believe this is the first existing in other companies. And then we said, okay, as we have this group working on that and looking to exchange with many others, with you, Kearney, and others, what are the things where we at Bayer can really contribute? We said, okay, I think 3 things. Being a life sciences company, we said we can definitely contribute in the research and development. Because I think we know already a lot of how heat and climate change is affecting even mental health, but the truth is that there's still many unknowns. And we therefore need research and development, also how it affects women, elderly, children especially. So that's the first one. Certainly, then the second, and how do we produce medicines, being sustainable about it, make sure that we have the less impact possible in nature. And the third, and this is something that will be close to Sangita, is that we said, well, if what we face is so huge, our health systems, our health professionals, our hospitals are in front of just tremendous challenges. And how do we as a pharmaceutical company can work with them to think about education, to think about what are clinical guidelines, to work with governments, and I'll talk about more later, but let me give it over to Sangita, to work with you as the system in order for us to advance the information needed, the preparation needed, and that's how we started. And then I'll tell you a little bit more.
Yeah, no, look, amazing, and I think just to hear about the commitment from the most senior levels of the organization to take this topic on is, inspiring, but also, really facing into the challenges that you described. Maybe Sangita, love to just bring you into the conversation. You've obviously got a very broad healthcare delivery perspective and a provider perspective. How do we make our systems more inclusive without compromising quality, our ability to operate at scale? What's your perspective on that? So if going from sort of the challenge to some of the opportunity, but if you think about this more from an inclusive perspective, what's your perspective, and how does Apollo Health think about that?
So thank you. I'm glad that we're sitting on this panel, which is looking into the future of humanity, not just healthcare. And it's important to start the dialogue and the conversation now so that we can begin to make change, because sustainability actually sits at the intersection of capital, policy, innovation, and execution in communities. It's a combination. We need them all. And I also believe it's not about current health systems thinking what can they do incrementally. It's about all of society thinking what we can do together. This criticality of redesign and innovation to focus on the scale of the problem, to begin with bringing people together. And therefore, I'm very happy that you said, what can we do together? I want to take half a minute to describe our ecosystem, because I feel that many of you in the audience are not from India. Most people in India would know us, but it's important for everybody to understand why I'm saying what I'm saying. And this is because of the last 40 years, we've dedicated our life to bring advanced healthcare within the reach of India. And with a lot of effort of over 100,000 people, we have patients from 140 countries coming into India for high quality care. But beyond the high-end curative care that we do, from heart transplants to cancer treatment, to critical, operations, we also moved into preventive healthcare and longevity. So we do approximately 3 million checkups, we're researching regenerative medicine, etc. And then we have the largest distribution chain of pharmacies, over 7,000 pharmacies. And we took all this and put a digital overlay. So we currently have about 8 million people who are connected with us through what I believe is one of the most powerful messengers of everything that we are doing, and that is the mobile phone. Because healthcare is moving from the hospital to the clinic, to medical centers, to homes, and finally to individuals who are connected 24/7 ubiquitously to knowledge and capability about healthcare through their mobile phones. So it's important for us to radically rethink this ecosystem, which we've been trying to do, to build a proactive preventive environment and to gather data seamlessly so that we can enhance the research about this. And now coming to this critical subject on hand, there is need for data to create research. There's need for new care guidelines, because I think when people are coming into the hospital with a fever or a complication, many of the SOPs are not even integrating what was the ambient temperature. When people are coming in with a cough, are we looking at air quality index and correlating that to pollution? So there's a critical need to gather the data appropriately, have it available for clinicians at the right time and for public, and to begin to talk about the interface between environment and health and illness presentation. I want to kind of, end this bit of the conversation by saying that I had the most delightful conversation with Soumya Swaminathan, who was the head of the World Health Organization, and she is beginning to work with us, and we have promised to give her data and clinical insights to build a climate impact study. And I'd be very happy to bring her into the conversation, to bring our organization into the conversation and share the data. But I just want to, one point, which I should have begun with, let's get a little light over here, is that it's only the women who could have chosen this kind of a location to have this program. I've been sitting in crowded, heated, beautiful Congress, lovely rooms, but look at this view. So it is the women who can stand up and say, we do things differently. Women have been the sustainers of healthcare. Let us become the creators and the innovators of a new health and happiness index for communities, because health and happiness are intrinsically linked, and women are the creators of health and happiness. So very, very happy to see all of you and be here with you at this panel.
Amazing, Sangita, thank you. And by the way, this is the most beautiful view of all of Davos. Mostly, you get the opportunity sometimes to get up here at the end of the week, but you don't actually, often get here for a meeting. And you just actually, we didn't coordinate on this. My final line was going to be women moving from delivery of healthcare to shaping healthcare. Absolutely. And it's absolutely on message. And so I think maybe what we'll do is we'll move back, Helga, to you. And I'd love to talk about how you think about the role of sustainability in shaping the future of healthcare and food systems, because I think obviously that all goes together. And just maybe from the perspective of Bayer, how are you thinking about that?
Yes, as I mentioned, given that we are across food and health and women's health and nutrition, we are indeed trying to connect all these dots and acting acting on all of them. Now, if I might just say, because you said, and following to Sangita, how can we then work and what exactly do we want to work with governments and organizations? And what's interesting with the World Health Organization, Sangita, this would be interesting to you, we identified 3 areas where companies like ours can really help. And one is evidence generation, right? Understanding, knowledgeable, I think everybody can hear me. I wasn't even using the microphone, but it's very silent, very good. So understanding where are our knowledge gaps, and also understanding that maybe governments can prioritize in their national health plans exactly that knowledge gap to look into research and development. The second is evidence-based action. Okay, if one is the research we need to do. The second on the evidence-based action, well, what are the products and tools that we need to adapt? And you were mentioning that, right? Will a doctor know exactly what was the temperature, what was the air index, how they need to have all these tools at hand to best treat patients? And the last one, I think it's extremely important to track the impact, but also track it with a gender-sensitive lens. And here again, let me just give you one number of what we are starting to see in the science, that if the temperature increases 1 degree, we see 5% more stillbirths or early births. So it's about absolutely humanity, right? Pregnant women here are very much at risk. So those are the areas where we are seeing, and when you ask us, well, how do we embed it in? For us, it is really, we need to solve the problems of the future. And the problems of the future that unfortunately we're seeing already today far too soon means what food are we going to grow in a climate change, what health, we are seeing a lot of chronic kidney diseases. Farmers in Central America, we are probably seeing that this is even a new disease that so we need to embed it in everything we do, because otherwise we will not be able to serve people.
Well, and I think what you're saying is we're seeing this today,
Yes.
right? We're seeing this today, but the challenge is, it's where is it going and how do we get ahead of that?
Mm-hmm.
I know that we've got to keep the conversation moving along here. Sangita, I was going to turn it to you. With this focus on, keeping humanity at the heart of healthcare, how do you think about, especially when we're bringing technology, AI, everything into the health system, how do we make sure that we don't lose that humanitarian compassion and, just what's at the heart of humanity, especially with someone with, kind of a technology background and a technology mission connected to humanity?
So that's a beautiful question, really, because again, here in Davos, every third word that all of us heard was AI, except of course in the President of America's speech, where we never heard that much, but that was an interesting one. But coming back, I think healthcare is about emotional connect. It's about dignity. It's about trust. It's about people. But it's also about huge data science, interpretation, presentation. It's the genetic profile, it's biology, it's bytes, it's bandwidth. But we must always remember that high tech can never succeed if it's not connected with high touch. And that's really where the healthcare that we design is based on that. And I think that it's a beautiful combination to have women in health. I've spent 40 years of my life dedicated to advancing healthcare. And the last 5 years have been focused on women and equity along with healthcare. So I had the privilege of leading G20 Empower, which is the women's wing. I've led various other women's organizations. And I think there is so much ground for us to cover. But I'm super positive about where we're going. You saw the earlier young women on the panel. I know all of them, have worked with many of them. The BRICS Women's Empowerment is something I handed over to Avani. I was the head of that and handed over. So I think that we're in the most positive time because technology is enabling women to be equal. The industry and the society which celebrated physical strength is transforming to a very different kind of world. And in that world, it's become a great leveler. From this platform, it's for us to stand up and take the additional roles that the world is giving us the opportunity to. And women in healthcare are very powerful. In the earlier panel I was talking about, I was specially called out because we have more women on our board than we have men. And I also say, and with great, this thing to the men in the room, that we must stop looking at humanity from a gender lens at a time of performance and capability. It's what are you capable of doing? What do you bring to the table? What impact are you going to have? What quality you bring? So the world has come almost to that point, but I must say that there are still many pockets of the world where women have a second-class citizenship. So we who have been privileged to be in these type of environments must not forget that women still need support, need more further education, societies need to be re-educated on the role, the power, the capability of women. Having said that, for the women who have reached this level, let's not use or ask for any special treatment. Let's say that the bigger battle is outside in helping solve problems of the world together as men and women. Because if we create too much divide, then diversity becomes a bad word, as it is being said in some countries. What we need to talk about is just universal equity and a better world altogether. So I'm very keen on that point of equity. The second very important one that you spoke about that I will come back to is I think that health systems have a tremendous role to play in critical redesign of the environments, integrating technology and enabling technology to give time back to clinicians because you're using co-pilots and agentic AI, and therefore they have more time to hold your hand and talk to the patient, which is probably one of the accelerators of recovery. Give time, capability, robotics, automation to our nurses so that they're not suffering burnout and they're doing a better program. Give time and design thinking to the back-end administration so that with systems design and re-engineering, we streamline protocols because there is so much waste in the healthcare system. I built a technology company 20 years ago where we discovered that 27 cents of every dollar in the American healthcare system went into back-end processing. I dedicated that in India we will have the lowest back-end per transaction cost compared to any country in the world. We're less than 4%.
Amazing.
So these are the kind of things that we can see and learn. So we're here to be privileged to be at Davos. Every third person has, a position of impact. What can we learn and share so that we help shape a better world in whichever field we're in?
I love it, and I love what you're doing at Apollo Health. I think we started with some of the facts, and I think, Helga, you promised us that you would end on a more of an inspiring note. So maybe, for your kind of last comments is talk a little bit about, some of the solutions really that are bringing health climate together in a way that, just shows what's possible. And we know we have more work to do, but showing what's possible and what is actually happening now. And then I'd love equally, Sangita, to hear what is happening on the ground. What are women doing on the ground at this intersection?
I'd love to.
And hear your final thoughts there.
Okay.
Yeah, I think two things, that we're learning to work with institutions and governments at the local level in a different way. As a pharmaceutical company, we need to get in there and think, how do we strengthen the health systems? How do we work with the local governments to understand what are their needs? We are doing a study with a feasibility study actually that we're going to choose 2 or 3 Indian states based on geography, based on needs, etc., and try to do a report exactly what will they need in their system. And it has to be exactly very local because we need to reach the people. So we'll talk about that, Sangita. That's one, and what I mentioned with the World Health Organization. If I can have a wish, since we're inspiring and we have a very beautiful view at the end, I want to say that I think for healthcare of the future, we need 2 mind shifts. We need to change the understanding of health in 2 aspects. One, that it's really not about treating the disease at the end, but it's about the self-care, the nutrition, having nutritious food, access to nutritious food, and to that people have access to really take care of themselves until we treat the disease, and there's tons of innovation in that. So that continuum of health, that is a mind shift that we need to have. And the second, and you all remember the pandemic, right? If something that the pandemic shows us is the tremendous economic impact of when we don't have health, but we have continued to see health as a cost, as a burden to governments, and we need to see them as investment into our productivity, and especially because what we will be facing with the climate change. So those two mind shifts would be my wish, and thanks for bringing us all here together to in this conversation to hopefully achieve it.
Excellent. Thank you, Helga. Sangita, final words from you.
So I think the first one is really about inclusion. So reliable quality and scale for both men, women, and irrespective of which pin code you're born, may every child and every baby have the same right to health, to education, to nutrition, and to be able to think and dream of growing up healthy, strong, and contributing. The second one I want to say is really that the future of healthcare must be digital, but must also be deeply humane, incorporating the high tech with the high touch. The third one, which is really the core of what we are supposed to be talking about at our panel, but there's so many more exciting things, so we combined it all, and that is that climate must be embedded into preventive healthcare, into design of care protocols, and climate is intrinsically proven now with data to be linked to longevity. So if we're looking at and hoping for longevity for the world and healthy longevity, then let us wake up to the criticality of climate and environment and become advocates for it. Because there are many things that you can create your own ecosystem. But however rich a person is, they cannot create the air they breathe in unless, of course, they fly to St. Moritz and live here, but that's a blessing for a few. So it's important for us to begin to speak about this, of equity as well as environment, to bring it all together. And in terms of wish, I think the biggest wish that I would have is that I believe that there is truly no problem that we cannot solve if we have the will to do so for the sake of humanity and the ability to partner and collaborate. So I'm going to begin by collaborating with you, but I think that we must talk together. Individual voices are not strong or loud enough for the problem we have on hand. It's equity that we must talk about. We need to reach out and pull up the next woman who needs to stand strong. And it's environment that we have to talk about so that we can collaborate in many, many ways to ensure that climate change does not leave us in a world that we are ashamed to bring our children and our grandchildren. And that is really what we're at the brink of. We cannot miss the fact that there is a potential existential crisis. In as much as we did not work enough and understand and predict the pandemic, we were at a panel where they were saying that they were discussing in January of 2020 in Davos, and only a few people said something's happening. And then they said, no, it's influenza. Davos 2020 is recorded as a super spreader event, and the pandemic was declared in March, but the beginnings had happened. So let us understand that sometimes we overestimate the impact of some things which are going to happen in the short term, but we underestimate the impact of things which are happening in the long term. Climate change is happening in the long term. We are underestimating its impact. We need to wake up now. And I want to conclude by saying that women can make the difference. We are the sustainers of the healthcare today. Let us become the innovators and the creators of healthcare tomorrow.
Very good. All right, we're gonna move, and just to say a huge thank you, Helga, Sangita.
And thank you.
so
Thank you.
much.
Thank you.
Yes, really a pleasure.